Hi, I'm Ashley, Senior Clinical Advisor at Carepatron, and I'm here to help guide you through the torn meniscus symptoms assessment or test. So what is the torn meniscus symptoms test? A torn meniscus is an injury to the knee joint that affects the cushioning cartilage known as meniscus. It is most often seen in athletes and active individuals, but can occur in anyone due to age-related wear and tear or trauma. A meniscal tear can vary in severity, ranging from minor tears, which may not require treatment, to more severe tears that can cause intense pain. The torn meniscus symptoms test, also known as the McMurray test, is designed to help evaluate the severity of a torn meniscus. It is done by manipulating the knee joint to identify any popping or clicking sounds that could indicate an injury. During the test, the doctor will typically press down on the knee from both sides and twist it to assess how freely it moves. Additional tests such as an MRI may be ordered to better understand the injury. There are a variety of healthcare professionals who can use this test, however, it's commonly used by physical therapists. Here's how you can use a torn meniscus symptoms test. The first step is to fill out the essential information and read all the instructions. The second step is to then conduct the test, making note of symptoms relevant to the patient at hand. Finally, integrate results within the treatment plan. To view a sample assessment of the torn meniscus symptoms test, feel free to visit carepatron.com where you can download and access it for free. You can also access it through our platform, filter by community and by test. You can also type in the keywords to find the note faster. Thanks for watching, and remember to subscribe to Carepatron to view more healthcare videos.